before we start, this episode briefly mentions pregnancy loss. We don't go into any detail, but we wanted to let you know just in case it's a sensitive topic for you today.
Hi everyone, welcome to the Diversity Rocks podcast, brought to you by Orange Orchid. And at Orange Orchid, our mission is that we are striving for everybody at work and in society to feel like they belong. We like to disrupt the system. My name's Liz Critchley, pronouns are she, her. I'm a white woman who is now 50. I have blonde hair with a fringe, and today I'm wearing a black top. I'm delighted today to be joined by Siera Torontow and Clara Ali Ghalib from Work Health Experts. So we'll say hi and get them to say hi first before we dive in. Hi, Clara. Hi, Siera.
Hello, excited
Hi,
to be here.
so happy to be here.
So, Siera, do you want to just say a quick hi and tell everyone who you are?
Yes, so hi, I'm Siera Torontow. My pronouns are she, her. I am a white woman in my mid-30s with fluffy, curly hair wearing a white top today.
Lovely, thank you. Clara?
Hi, everyone. My name is Clara. I am a Middle Eastern woman. My pronouns are she, her. I have black, straight hair that's in a slick back bun, and I'm wearing my favorite color, pink top today.
Very bright and sunny today. So
Yeah.
fitting with the weather. So thanks so much for joining me on the podcast. So you are from Work Health Experts. First question I always ask, tell us your origin story. So why, how have you got to be here where you are today? Who's going to go first?
I feel like Clara always tells this one in
Yeah.
a great way. Yeah.
Tell us your origin story, Clara.
So, God, this is going back a few years now. So during COVID, I did a business degree at Imperial College Business School, and Sierra was doing her MBA. And at the end of for my thesis, I really wanted to interview women that were in leadership positions, but because I didn't know how I was going to pivot my career, I wanted someone that worked in like tech and consulting, someone that worked in nonprofit organizations, etc. And the vice dean of the school was like, you should meet this woman named Sierra. She's excellent. She's in a leadership position. So I reached out to Sierra and had explained what my thesis was on. And in true Sierra fashion, she was like, I have time 100%, but it'll be like a walking Zoom in between my meetings during COVID. So that was, we got to know each other then. And around a year after, we were both invited back to an alumni meeting or an alumni gathering at the Gherkin in East London. And we spoke like really briefly because I think you were leaving and I had just arrived or something. And then a few months later, Sarah and we ended up sitting right beside each other at a nail salon. And when we
Oh,
were at the Gherkin, I think we had exchanged LinkedIn, and Sarah was like, oh, I'll send you my number, send me a message, and let's go for a walk or a talk or whatever. And yeah, a few months later, we're randomly sitting beside each other at a nail salon in London, like with 12 million people. It's so crazy. This is why I'm always like, it was faith, that brought us together. And then Sarah looks at me and was like, you never messaged me on LinkedIn. And I was like, or you never messaged me, you never texted me. And I was like, no, 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 I definitely messaged you. And I was showing her the message, but it ended up going to like the wrong number.
oh,
So anyway, fate brought us together that day, and it was the day. Then we decided to actually go for a walk, and as fitting as it was International Women's Day that we
oh.
ended up going for a walk together. And I had just left my job in consulting, so I was like pivoting my career for the second time. Sierra had already started what our company was formerly known as Girl, You Need to Know This. And we both really aligned on what we wanted to achieve and, all the disparities in health education that we had seen from both of our perspectives and both of our experiences. So we were like, okay, we're both pretty, similar personalities, both type A, super go-getters. Why don't we just see if we can work together or, have a partnership for 6 months and take it from there. 6 months later, we met up again because I was away for the summer, but we were, consistently like working on the company at the time and or on the mission that we both had shared at the time. And on a Tuesday, we were like, okay, should we set up the company? on the Wednesday, Sierra was over at my place with a bottle of champagne, incorporating the company with someone, one of my friends who had experience doing it through the portal, company's house. And then on the Friday, Sierra, handed her notice. So that was my perspective. It was really a whirlwind. I don't know if you want
I
to add
know.
anything to that, Sierra.
Yeah, no, it was very serendipitous. I think timing is always one of these things that you have to be in the right place, right time. And I think
Yeah.
Clara, she hasn't mentioned it yet, so she's the clinical director of our company and a clinical pharmacist. And I don't have a clinical background, but have worked in healthcare for I can't believe I'm saying 15 years now, in a commercial capacity. So um, I was looking for clinicians that really had the drive to improve things outside of the healthcare space, in more in the workplace. And Clara just, yeah, lights up the world when you speak to her. She's very engaging and mission driven. I will say went to the gherkin event just because I wanted to see what was inside the gherkin.
Yeah.
Had nothing to do with the content or the people. I was like, what does the inside of the gherkin look like? And let me tell you, it is just boring meeting rooms. It is
Oh,
Yeah,
not
clear
that cool.
glass.
So
Yeah.
in case that was like a little, spark for someone, like, oh, what's in the gherkin? Nothing is there. But yeah, just accidentally we, live in the same, and especially I feel like not as many people who uh, go to the university we went to live in East London because it's so far west. So it's kind of serendipitous that we're both genuinely living a block away from each other and just happened to be at the nail salon at the same time. But that timing goes back um, well over nearly 3 years ago. So
Yeah.
we've been on a journey, we've been on a rebrand, we've pivoted and changed, and we can talk about all these things.
Yeah, she
But
actually
that's
mentioned.
definitely our origin story. And it some days it feels like we've only been doing this for a short time, and other days it feels like decades. And Clara and I, prior to starting the business, we were friendly, but we definitely weren't friends.
Yeah.
I didn't know anything about her life or what she goes through on a day-to-day basis. So it's been such a privilege and pleasure of mine to get to know her not only as my business partner, but also as a really good friend.
Oh,
Yeah.
that's
And
great to hear.
I'm getting married in a few weeks, and Sierra's one of my bridesmaids, and I
How
think that's a real testament
exciting.
to how much we care about each other. Yeah, and we still live like right across the canal from one another, so we're only like a 3-minute walk from each other, which is really nice. And I think again, it's just the way the world has brought us together.
Handy for those walk-in meetings if you're only, yeah,
Totally, we had one
three
this
minutes
morning.
away.
Yeah,
Yeah.
amazing. You know.
So tell me where the interest in work health comes from. It sounds like you've both got backgrounds from a medical perspective, but what was it, if you're going to start up a business, what was it that made you think? Because there's a lot of talk, isn't there now, about well-being at work. What
Yeah.
was it that pulled you to kind of people's health while they're at work in particular?
Yeah, so that is actually a really great question. I think for me, so I have a background as a clinical pharmacist. I worked in the largest trauma hospital in Ireland for 6 years, and just, being counseling patients over 4,000 patients every year, you get to understand that there's a huge lack of knowledge. And it's not the complicated medical knowledge, it's actually the really simple stuff. People don't know enough about their health or their bodies or anything that they take. Doctor prescribes medication, someone could be on it lifelong, and they still don't know the name of the medication, let's say. And then I ended up doing a business degree. I moved to London, did a business degree because I wanted to learn more about the corporate side of things. And I knew that in my heart that I was a founder, I had that
Hmm.
entrepreneurial spirit. And then I'm Middle Eastern by origin, and I'm Kurdish from Iraq. And going back and forth, I always saw women in the Middle East, especially where I'm from, didn't have access to really good quality supplements. So then I went on a journey of like understanding that people don't have the education, and then in the Middle East they don't have the access to the product. So I founded a nutraceutical company where I formulate nutraceuticals for women's fertility supplements to help them on their fertility journey, but also to help with pre, during, and post conception. And then even with that, I still found that people just did not know anything about their fertility either. So I was working consulting at the time, and when Sierra said earlier about it being the right time for us, I had just left my job in consulting because I wanted to start a podcast that was educating women on their health. Um, because again, it was like very apparent, didn't matter what part of the world I was in, whether I was in Europe or in the Middle East, the issues and the lack of knowledge was the same, whether you're an acute patient or just someone going about your day-to-day life.
Mm.
So that's where my part comes from. Sierra, I'll
It
hand it over to you.
before we go to Sierra, just to point on that, resonated with me. I quite often say I'm like a maraca. I'm on so many tablets from the doctors for all sorts of different things. And could I honestly tell you in any detail what I can just about remember what they're called, but that probably took a couple of years, just because when
Yes,
you have to ring up for your repeat prescription.
exactly.
But I
Yeah.
think, and I don't know whether it's a British thing, but we have relatives in the States and they go into a lot more detail about, well, what is it? Well, what are the side effects? Well,
Yes.
where has it come from? And they'll, you'll mention something in passing and they'll ask me and I'll go, I don't know. The doctor prescribed it, and I trust the doctor, and so I'm just taking this medication.
Yeah.
They
Yeah.
they can't believe how kind of laissez-faire, we are sometimes. But I think it is changing a bit, isn't it? People are getting more interested in, particularly from a chemical perspective, as we're putting all these drugs in
Totally.
our systems.
I think what I've seen throughout the years, Liz, and you're so right. It's like when something happens to someone's health, immediately with the healthcare team, they're like, "What medication are you on?" And that's when the alarm bells kick off, and patients ask themselves, "I do take something for this, and I take something for that," but they don't know the detail. And a lot of it maybe is also down to the way the healthcare system is. Every like doctors, GPs, everyone, nurses, they're all genuinely doing their best. But with a system that is overwhelmed and under so much pressure,
Hmm.
unfortunately, it's the patients and people that end up not having the privilege of actually sitting down and talking with your healthcare provider. Because actually, if you and I sat down and went through your medicines and we had the time, the luxury of time, I'd explain it to you in a way that you'd never forget.
Hmm.
Like you don't need to know the chemical names of things, but you do need to know what you're taking and why you're taking it.
Yeah.
So it is a systemic problem for
That
sure.
feels like a whole separate meeting that we need to have, Clara, at some point.
Yeah.
Sierra, sorry, we went off on a tangent
No,
then.
that's
So
great.
tell us your interest in health, work health.
Yes, so I'm originally from Canada. I started my career in healthcare and pharmaceuticals, educating clinicians on ADHD medication, and really understanding that even doctors have to be educated on the things that they're prescribing. And then I transitioned into providing clinical decision support tools for healthcare systems. And what that means in simple terms is when you go in to a hospital, they have to, lots of things are still on paper, but they have to write orders and they have to process them. And how that's done is changing, but most of it is being digitized. And I was helping um, the CIO, Chief Information Officer, or the Chief Medical Information Officer, essentially have a strategy of how to integrate evidence, clinical evidence, into practice so that they're providing the most up-to-date information. Because, and this is going back a lot of years now, because after that I had a stint in consulting for 4 years. But while I was doing that, which I did for 5 years, medical information was doubling at a rate of 73 days. So doctors, nurses, they can't keep up with the latest evidence. It's just how it is. But that's why we have the internet and we have tools and AIs improving these things. But to get evidence into practice also takes time because people don't even know what they don't know. So from a medical perspective, I can see like if doctors, aren't even up to date on some of the latest evidence, clinical trials, what's going on, how are patients going to be? And then I moved into consulting, which it sounds like a major shift in terms of what I was doing, but it actually was very relatable. I was essentially helping corporate affairs and communication officers with their ESG strategies, so their environmental, social, and governance strategies. So in terms of like the tactical, breaking down problems, having solutions, it is very similar in that sense. And I should mention, so yeah, I said I was from Canada. I lived in Australia for 5 years, and now I've been in the UK for 8 years, but I've been on international teams. So I've actually got to see and work across multiple healthcare systems and multiple workforces and seeing the differences in how people operate. But while I was doing that consulting bit and advising on environmental, social, and governance, I realized the S, the social bit, the bit about the people was just shocking. Even if they had a few, I want to say, initiatives that they were doing in comparison to the environmental ones that we see, plastered everywhere. And it's super important. I'm not saying one is, deserves more attention, but at the end of the day, people are people. And I think that should be an organization's number one priority. And as somebody who has autoimmune condition, as well as has been through pregnancy and postpartum and has had to actually interact at these moments of time, it's really, it was frustrating to me at why don't we learn this stuff before the fact? Why is it always when we're in crisis, when it's after? And then given that you spend 8, 9, 10 hours a day at work, or for those that are blessed and fortunate, 4 or 5 hours a day at work, these are the places you have to learn these things, because you're not going to do it after hours while you have caregiver responsibilities or a life, right? So I thought the fact I could just see that the workplace is the place to learn about this, and burnout shouldn't be tolerated. Like how people dismiss symptoms shouldn't be tolerated. And even simple things like going and getting a cervical screening, which you do once every 3 to 5 years. And it should take, even with commuting and everything, like 90 minutes. People aren't taking the time to go do that, which is just, it's not good enough. So yeah, we're trying to change the way people think about health at work. The fact that it is part of your inclusion strategy, it is part of employee well-being. It's also part of learning and development, because it's not a thing that you push aside. You have to actively learn, remember, retain this information. So we kind of sit at that intersection of those three things. And I think depending on the organization and their priorities, we can, pull certain levers to support them in that. But I think, yeah, I could go off about a lot of stuff, but I think your manager has, so much of your health in their hands, and how they talk to you and how they, respond to your requests and how they give you the flexibility that you need, etc. So if people can understand the basics of health, when it comes to menopause, or if somebody is going through infertility challenges, or somebody experiences a miscarriage, or like I said, even just taking a time once every 3 years to go get a cervical screening, these are not isolated incidents. This is life, and life should be brought to work.
Yeah.
And it's interesting because you talk about being part of inclusion strategy, and well-being is a hot topic at the moment. There's lots of organizations talking about well-being. Personally, I think there's a lot of surface level conversations, but perhaps we can get into that a bit later. What I'm interested in on the inclusion front is, very much I believe that people should feel like they belong at work or anywhere in society. You should feel like you can bring your whole self and do what you need to do. And I wonder whether, I always talk about belonging from a cultural sense, but I wonder from a clinical perspective, what's happening in our mind and body when people don't feel like they belong? Is there a medical element to that, actually either not feeling like I belong or not feeling like an ask to go to that appointment, or whether it's acceptable? What's going on from the clinical perspective, do you think?
Liz, that's a really, really great question. And I think, that feeling of belonging is not just about feeling sad, you know, and I think everyone throughout their entire life, from when they're, you know, a kid at a playground to when they're much older, um, that feeling of belonging, that feeling of not belonging can resonate with a lot of people. But I think clinically, when someone has that feeling of not belonging, it creates a state of chronic stress. And the body, when you're in stress, that means your body is in a constant fight or flight response. And that leads to numerous neurological, physiological changes. And being in fight or flight, it doesn't, like, that's not a metaphor. It's actually a very real chemical reaction that happens in the body. And it is a response to a perceived threat. And then when you're in that perceived threat, your body is in a constant state of stress. And we see that through what changes in the body, which is an elevated level of cortisol, which is stress hormone, and adrenaline. And that directly impacts health as well. Throughout the years, like I've seen with so many patients, when they present, whether it's in a hospital setting or in a primary care setting, like in a GP practice or in a pharmacy, they present with symptoms that are always traced back to like a work environment, whether it's headaches or they have gastrointestinal, GI problems, if they have elevated blood pressure. And that's the physical side, never mind the mental health side of things. You know, a feeling of isolation can contribute to anxiety, can contribute to depression. As Sierra mentioned before, it can contribute to stress and burnout. And, you know, I think from my perspective as a clinical pharmacist, we treat these symptoms with medication, but actually the most effective treatment to address these issues is the root cause, which more often than not is an environment. And if we spend the majority of our time in work, then it can be a non-inclusive or even a toxic environment that can really have huge impacts on people's health.
So I guess what we're saying commercially, you know, the choice for organizations is don't focus on the root cause and the creating that environment of belonging, and the price you'll pay is employee sickness and absence. You know, so spend your time and money up front to address the root cause is a much better way than not doing that. And then we know the result of that will be poor health and potentially absence from work or lack of productivity because people are stressed and, you know, not in a good environment.
Yeah, it's interesting because I
Absolutely.
think we say it's preventative, but at the same time, so many people are currently struggling. It's not even that we're preventing the struggle. We're actually just telling them, we're giving them the vocabulary and the understanding so that they can make changes. Because also, it's not just about information. If that was it alone, we'd all be healthy, happy, and you know, you could go on ChatGPT and solve everything. That's not the case. It's and what do you do about it? And how can you get support? And how do you talk about these things? Because it's not just, again, signs and symptoms of somebody who has lived experience, but truly, how can you support someone? And what are the do's and don'ts of what not to say if you're their manager? Because for somebody that's going through something as challenging as pregnancy loss or grief of a certain sort, there is ways to handle it and there are ways not to handle it. And most people aren't taught how to deal with grief. It's not part of our education system. But if you are in a workforce, it's likely that some sort of grief is going to come up for one of your colleagues at some point. So managing that so it doesn't make it more stressful, more difficult for them to cope, and then their health is in jeopardy, is really important.
And it strikes me just when you mentioned almost in the same sentence about ChatGPT and managers having the skills to help people through things like grief. I wonder, I have a view on kind of how is AI going to change our lives, full stop, our lives at work, because we have such great access to information now at a speed we've never had before. For me, what ChatGPT, what AI, let's say, let's not just narrow it down, isn't giving us is the ability to interact with other human beings, showing empathy, knowing what to say when somebody's grieving. I wonder
No,
what
let's
your view is.
be, yeah, let's be very direct though, is it doesn't actually always give you the right information. So it gives you
No.
some information, but you know, we have dozens of topics that we talk about, and we use ChatGPT as like a brainstorming tool and an editing tool, but it comes back wrong. Like there are things that come back blatantly wrong. And
All the
so
time.
we take, yeah, all the time, exactly. So we have a very thorough approach in terms of we have minimum two clinical professionals review all of our content, if not 4 or 5, depending on the topic. But I don't think you can rely on it even for information. Yes, there's tons of it, but is it current? Is it credible? Is it appropriate for you? Not, I would say generally probably not. But does
And
it give you a starting place to, you know, explore? Absolutely.
And I just want to add to that, like, I completely agree with Sierra. It's having AI and having these tools, they are incredible for productivity. They're incredible for accelerating our learning so that we can advocate for ourselves. But they are not your personalized, tailored healthcare professional who knows your whole medical history. And that is where the dangers come in, just because you ask it. And also, the AI tools are only as good as your prompt, but do you have the medical background to take your own medical history to allow it to give you an accurate piece of information for you? No, people go through 10, 15 years of medical training to be able to do that for you. So I think, especially in some of the socialist countries and, within the UK and Ireland where I've worked, it's easy to compare a 10-minute doctor's appointment to what you'd get online, but actually when AI is not seeing repeated patterns, AI is not seeing that you were there a week ago with a flu and now you've returned with a different type of inflammation. So I think it's dangerous to discredit how important it is to, yes, go get your information, but go and advocate for yourself with a real healthcare professional.
Yeah.
AI is never going to be able to take your blood for you and interpret that.
Yeah,
Um,
definitely.
so pros and cons, definitely.
But I think that the element really for me is that human interaction. We want people to understand, or at least try and understand what we're going through. So if you are experiencing something at work with your health or grief, as you say, Sierra, having a human being that can say the right things is actually really important from a work perspective.
Liz,
Which, yeah, of
sorry, can
course,
I
yeah.
just add to that? Like, we also say, and something that we are really passionate about when we do, as part of our sessions, the communication element. And, we want to empower everyone to be able to talk about their health, but also if you don't have that lived experience and you're a manager, how do you deal with your team? Something that we want to say is that you don't have to be, like, as a manager, you don't have to be the expert in that topic. If you've someone on your team going through a fertility journey or someone on your team going through a miscarriage, no one's expecting you to have the clinical knowledge and act as their obstetric gynecologist or their fertility specialist. But it's more about how can you communicate with your team to showcase that you're creating some psychological safety for them, you're treating them with compassion, empathy, and also, making sure that they understand that they can go to you with what they need. So it's really a communication thing, not a we expect managers to be experts in these topics.
So you mentioned the term psychological safety there, which is really important in a workplace. From the work that you've done, what does that look like? What does it feel like? Psychological safety. What does it mean to you in the work that you're doing? How do you
So
know whether
I think,
someone's got it or not?
yeah,
Yeah.
no, exactly. So we actually ask people, what does it mean to you if you have a regulated nervous system? What does it mean? Do you know?
Tell me the question again.
What does it mean to you if you have a regulated nervous system?
Oh.
We don't judge, Liz. This is
Yeah.
just, no judgment here.
But
Most
this is how
people
we
don't
start the
know.
conversation. What
Yeah.
does it mean?
Yeah.
Oh, I would say, to me, if you ask me that question, I would say I'm in control. I'm in control of my reactions to things. That's what it would mean to me.
Okay,
It's a
yeah, and
very
that's,
good
I think
response.
that's a good great indicator, because actually if you're snapping at your kids always or really angry, but there's probably something going on. But it also means you sleep well at night, you don't wake up, disturbed. Your digestion is good, you have normal bowel movements. There's multiple, anyways, we go through these things, and people, I think, don't even recognize that there's actual real symptoms that you can showcase that your system, your nervous system isn't regulated. So if you can teach people, like, hey, that person who's been having stomach pains, and don't get me wrong, it might be more than just stress, they could have a real serious issue, but it could also be just a little red flag of, like, you're doing too much, or this thing is actually causing you more stress. It's funny, personally, I have broken out in rashes just from stress. And I'm saying, verbally, I'm going, I'm fine, I'm fine. But clearly your body's like, no, you're not
You're not
fine.
fine.
and
Uh,
and you should recognize that. And then you can actually, like we said before, it's not just about knowing, it's about actioning the behavior to change what you need to change. And that might be setting boundaries, clocking off at a certain time, not saying yes to everything. There's lots of things that you could do. But I do think from a foundational perspective of knowing what a regulated nervous system is a great start.
Yeah, for sure. And I think that like that psychological safety is not just, you feeling comfortable at work. From a clinical perspective, it's the absence of like an immediate perceived threat when it comes to like a social context or a work context. And it's, when you bring it into work and having psychological safety, it means that, you feel like you're not going to be punished for speaking up or making a mistake or suggesting a new idea at a meeting. And when the safety isn't there, that's when your body starts to react as if this is a perceived threat or there's some danger. And then people become hesitant, they become a bit more anxious, they're not speaking up, they're hiding behind emails, or maybe they're not even sending those emails because it's causing them anxiety, and they're less likely to collaborate, which, of course, when you're working in most organizations and teams, that leads to poor outcomes. And just to like relate that back to what I said earlier, if you're considering someone going through like a fertility treatment, they might have to go through, they might need to ask their managers for leave multiple times throughout a year, throughout a week. And if you have a workplace that has real psychological, like true, authentic psychological safety, it means that those people feel safe to have an open and confidential conversation with their manager about their needs, knowing, how they'll need to be supported. And in an environment without their safety, without that psychological safety, they're hiding their situation. They're taking numerous sick leave, or they're pretending, their grandparents have passed away for the sixth time. They feel shame, anxiety about talking about things. And Liz, fundamentally, that ends up being burnout. Like that's how it ends up manifesting. And that's a huge, in those two scenarios, that's a huge difference, right? Someone feeling safe and not. And at the end of the day, what we're trying to do is move away from it's just the individual's responsibility. It's actually the organization's responsibility to also take care of the health of their employees.
And it strikes me that there's a couple of levels there, Clara, based on what you've just said. If there's a manager out there thinking, well, how do I make sure I'm creating psychological safety for my team? Just me as one manager and my team. How could a manager do that? And then I guess the next step on is how do we then influence the whole organization to adopt that and create that? Because I'm guessing you probably go in and quite quickly make a judgment on whether there's a good level of psychological safety or not. So if there's not, where do you start with helping organizations develop that?
Great question. I think it depends is the the short answer, because we work with organizations that are 150 people and we work with organizations that are 10,000 people. And the ones that are much larger, you don't have a gauge of each individual team or even the spread because they're just so massive. And as somebody who's worked on different teams across the globe, you can have a fantastic team that has great psychological safety in one part, in Australia, and then over in Canada, it could be really brutal. Like it is that manager to manager thing. But I think we always start by giving people advice of when you ask people how they are, you really ask and listen. And that takes practice and that takes consistency. And I think there is a way of being in the UK and British culture of not truly wanting the answer. It's more of a quick, how are you? But don't actually tell me how you are. Just say the weather's bad and then we'll move on to have our tea and, have a little goss. But I think when you ask them, hey, I'm here if you want to talk, and leaving the door open, again, maybe not overwhelmingly, but consistently enough that it's genuine and it is believed that if they need to tell you, hey, it's not okay, it wasn't a one-off or a passed by comment in the hall, it was a genuine interest. So I think that's the first thing that we always start with, which is actually very difficult for people to implement.
Yeah. And I think the point you made there, which is really important, is to believe people. I think, Clara, you made the point earlier about managers might not have lived experience of what their employees going through or their team members going through, and they're not expected to. But equally, if it is something they've been through, it's important to realize no two people are the same. So I can kind of almost picture conversations I've heard about, oh, well, when I had that, this happened, or I only needed one day off, or, and managers think they might be being supportive in sharing that lived experience, but actually realizing if somebody tells you it's quite severe and they need 3 days, believe them, they need 3 days.
And I think sometimes it's difficult for managers as well. Like I'm not assuming all managers are excellent people and excellent communicators. But, another thing that we implement into all of our health education topics is the communication piece, because at the end of the day, people want to work with people and people want to feel they spend all their time at work. They want to feel safe, happy. And, more often than not, it's not just about the work. Right? It's about who you're working with and the collaboration and the team. So it's really important. We say all the time, these conversations make for better culture. And if you want to shift the culture at your organization, you start with having these types of conversations.
And just to add, and you nailed it on the head, Liz, with don't offer comparisons. We also teach that in our sessions. Comparisons aren't helpful. Solutions actually aren't helpful. I think when people give advice, it's actually wild, the advice that people say, like, I took this supplement. It's like, one, you are not a medical professional, sir, and you have no idea what this medication this person's on or what they're dealing with. Like, please do not recommend the thing you bought off Amazon that's like changed your life. Like, I get that helped you. And I know this is the thing, people genuinely think they're being helpful. They're not doing it out of, malicious intent, but it's not about the intent. It's about the result. So we really encourage people to pause, listen more than you speak. And if you don't know how to signpost or how to offer support, learn those things, which is, again, part of the work that we do. But yeah, the comparisons are very unhelpful. And the advice or the comments, we have lists and lists because we collect them all the time, and we also get survey feedback, and we ask the questions of like, what's the most useless piece of advice you've got? So if anyone wants to see those, we have tons of examples of that.
That could be a hit, actually.
Yeah.
That could be a hit. Yeah, for sure.
So let's think about, I guess, the bigger picture now. I think, we've mentioned burnout a couple of times. It seems like everyone I'm speaking to at the moment, people's health is a big priority. There are a lot of people suffering with burnout. I think, I wonder from your perspective, what is what are the biggest kind of systemic barriers that are hurting our employee health right now? What's going on in the world? What's hurting our health?
Addressing systemic barriers is, I think Asiara would agree with me when I say it's a big part of our work. And a big systemic barrier that we have both seen is a reactive health model. Like the current and the old system is very reactive. An employee gets sick, they go to see their healthcare professional, they treat the symptoms with medication or whatever is deemed appropriate, and then they return back to the same environment, which can often be not supportive and toxic. So it's a cyclical system here. And so the system is really the problem, but we are only treating the individual when they're at a crisis state or at a point that's bad enough that they need to go seek external help. But with the work that we do, so with work health experts, the disruption that we are trying to actively champion is shifting that focus from fixing the employee to building a more supportive and healthier environment. And it's about looking at, these barriers that are causing the health problems, like, for example, 1 in 10 females suffer from endometriosis. And the old system is really about, the employee saying to their manager, I need time off. And, the burden is really on the employee to repeatedly have to justify their situation, even during severe period pain that can be completely crippling and impact their life, so regularly. But a disrupted, proactive system has potentially a policy about this, has leave embedded in it, has something in place for chronic conditions that are so prevalent within the workforce. And it's not just about a policy covering time off. It's about going back. It's about that psychological safety. There's a signal there for a sense of belonging and support in the workplace that removes stigma when it comes to talking about these things, removes the shame and the anxiety from the situation. So that's what I could go on and on about this, but that's genuinely what I think it is. It's about shifting from being proactive, it's about shifting from being reactive to proactive and removing those root causes that fundamentally impact people's health.
It's I was just going to say music to my ears, but I try not to use idioms because some people take them literally. It's great, but part of my mission, as I said at the start, is about disrupting the system, and I
Yeah.
completely agree. We've spent too long trying to change individuals to fit into our system, and we need to disrupt the system. So I'm going to come to you now, Sierra. What's your advice? What do we all need to do to disrupt the system?
I think Claire was spot on. I think I guess, myth I want to bust is that making adjustments doesn't mean somebody's less productive. And as somebody I have a chronic condition, and I, hand on heart, know I am one of the most productive people that you get to work with. But there will be moments that I can't do as much. But that doesn't mean that overall my value is any less than. And I think when people look at people that are different or they don't understand, they think, oh, they're not going to have the output that I want them to have. I think that's the default. And I think that's just wrong and misleading and not true. And so I want to create an environment where people at least have a basic understanding of things that are super, super common. So Clara mentioned endometriosis. I know we've mentioned several other either life stages or moments that happen to many, many people. And I also think that because we do have a lot of topics that address women's health or people with ovaries, but when we talk about things like fertility journeys, males, people, sperm producing partners, they are equally contributing to that journey and equally have as many issues. So the stigma of it's an individual's problem or it's a woman's problem just needs to go. And I think if we can give people, I think when you know how there's always the case of like when you understand somebody, you are more compassionate to them. So if we can give people a flavor, just a sprinkle to get that compassion juice flowing, our job is that. And I'm so I love the work that we do, because every time we run a workshop or a session, we genuinely get half a dozen messages in our inbox saying, thank you so much, you've changed this for me, or I felt unseen and now people know what I'm going through. Because I don't think the people that are going through endometriosis should be the ones holding the flag explaining what it is. Like, you're dealing with enough, or any other health scenario.
Okay, well, it's been so great talking to you, Clara and Siera. Thanks for your time. What's coming up with Work Health Experts then? What can we expect from you over the coming months?
For sure, a revamp of our socials. So keep an eye out, our TikTok and our Instagram and our LinkedIn. So if you don't follow us on that, please do. We're actively trying to build our community, and yeah, there'll be a lot of good content coming out on that.
And you have your own
Yeah.
podcast, yeah?
We do. It's called the Work Well Project, and it's essentially talking to business leaders and unpacking what's going well, what needs work, and talking about some of their failures and things we can learn from. So it's been really fun. There's people leaders, but also learning and development leads, and then also people that are just championing health in their organization. So it's quite insightful.
Well, we'll share all your links when this goes live, so that people can find that as well. So thanks so much. Good luck for the future, and hopefully we'll speak to you again soon.
Thank you
Thanks
so
for having us.
much.
It's been such a pleasure.
Thank you, Liz. It was wonderful.